Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this section, I'll be delving on the facts of systolic versus diastolic murmurs. We know there is a systole, which is between S1 and S2, and we know there is a diastole between S2 and S1. So you have lub dup, lup. In other words, lub dup, there's a pause, and then lub dup comes again. So systole is the period between lub dup and the pause is between the next lub dup, S2, S1, and that is the diastole. That's when the ventricles are relaxing. So when the ventricles contract, this is the systole. When the ventricles are relaxing, this is the diastolic period. Okay? So the entire cardiac cycle consists of systole and diastole. Lub dup, lub dup. Now, just to refresh, there are two chambers on the top. These are the atria, these are the ventricles. This is the right side, that's the left side. Left atrium conducts blood to the left ventricle through the mitral valve. Right atrium sends blood via the tricuspid valve into the right ventricle. There's a pulmonic valve at the pulmonary artery. There's an aortic valve at the aorta, right in the left ventricle here. So we have 4 valves and 4 chambers, right? Okay, now, regurgitation of the valve implies when the blood flow is backwards into the previous chamber. Remember, when the left atrium is entering into left ventricle, these valves should stay open at the time because the flow is forwards. But however, when the left ventricle is squeezing blood into the aorta, what will happen to these valves? They should stay closed, or they should go closed totally, shut closed. So, and if they don't, that's when the regurgitation occurs. So that's a regurgitation into the previous chamber. That's a backward flow. So regurgitation of the valve implies blood flow backwards into the previous chamber. Stenosis implies that the blood is not passing through these valves, through the narrowed valves. So their narrowing of the valve results into stenosis. Incompetence of the valves results into regurgitation. Simple? Okay. So now let's see, S1 being the first sound, S2 being the second sound. So S1 is produced by closure of the tricuspid valve and the mitral valve. S2 is produced by the closure of the aortic valve and the pulmonic valve. Simple. So during the time when the systole occurs, S1 will close. That means these 2 valves will close, so the blood is going up into the aorta here and up into the pulmonary artery. Now, as the ventricles begin to relax, these valves will close, the aortic valve and the pulmonic valve. And when they close, S2 is produced. So the whole phenomenon of systole is here. That means this is the time when the ventricles contracted. This is the onset of diastole. This period is onset of systole. From S1 to S2 is systole. S2 to S1 is diastole. That means the heart is filling. The ventricles are filling. When I say heart is filling, it's always in connection to the ventricles are filling. Now, in systolic murmurs, for instance, mitral valve is regurgitant. In other words, it's incompetent. So now when the left ventricle contracts, what will happen? Some of the blood will also go into the left atrium, and that's because of mitral regurgitation occurring, and it'll be in systole. Why? Because some of the blood regurgitated back and made that whooshing sound, and that turbulence within that mitral valve causes this phenomenon to be heard, and that's a systolic murmur. Now, if there was a diastolic problem, like an aortic regurgitation, how will that appear? When the ventricles are relaxing, the right ventricle and the left ventricle, the aortic valve and the pulmonic valve should ideally normally close. But because there's an aortic regurgitation, the valves don't close, so some of the blood will start regurgitating back into the left ventricle. And when it regurgitates back into the left ventricle, that occurs during diastole, and the sound is like a decrescendo. You see how I've shown a decrescendo? It's going downwards. So it starts at the onset of diastole, and by the time it arrives to the onset of systole, it's almost died. So in other words, this is the extra sound or the diastolic murmur that somebody hears between S2 and S1. Again, all of these murmurs are being appreciated by the stethoscope. Remember, stethoscope, which is the basic tool or device, a medical device that the doctor uses to hear your heart sounds. So mitral regurgitation gives a systolic murmur. Aortic regurgitation gives you a diastolic murmur. Now let's see here. If the aortic valve, and the converse is true, if the aortic stenosis is present, then you will have a rhomboid type of systolic murmur between S1 and S2, because the ventricle is trying to squeeze blood through the aorta up to the rest of the body. And because the valve is so narrowed, one sees a rhomboid form of extra sound produced between S1 and S2. And that is the aortic stenosis systolic murmur. And lastly, the diastolic murmur again comes in if there is mitral stenosis. Say these valves are narrowed or stenosed, the left atrium tries to empty into the left ventricle. And when will that occur? During the diastole. It's trying to empty, but it can't empty so well. So what happens is there is an extra sound like that occurring between S2 and S1. So we have aortic stenosis and mitral stenosis in systole and diastole respectively. And we have mitral regurgitation and aortic regurgitation in this setting, both in systole and diastole. So just try to familiarize this. Obviously, these are very intricate valve conditions, but hope I've been able to explain. Please share this knowledge with your friends as you move along. More intricacies are coming up, so get ready. Tighten your belts. All right, see you again. Bye.